Now, as the world marks the 2025 World Diabetes Day, stakeholders are calling for more support for people living with diabetes. This year's theme, Diabetes and Well-being, draws global attention to the need for holistic care, focusing not just on blood sugar control, but also on supporting the physical, emotional, and social well-being of those affected. The report.
World Diabetes Day 2025 is putting a major focus on the often overlooked connection between diabetes and well-being. Observed annually on November 14th, the campaign under the International Diabetes Federation is urging employers, employees, and policymakers to know more and do more for diabetes at work.
To improve shared decision-making, we can start by asking about the patient's daily life, income, and goals. We can offer realistic, affordable options and agree on small, achievable steps. It is best to use visual and local food examples and not complex charts. It is important to know that treatment should fit the patient's reality, not a textbook. But there are socioeconomic barriers beyond drug cost. This includes transport issues, food insecurity, job instability, and weak insurance coverage. Most Nigerians pay out of pocket, making continuity difficult. To fix this, we can expand the NHIS scheme coverage for chronic care, flexible clinic hours, and food transport and support. We can involve family members by assigning them as helpers and not supervisors. They can help by reminding doses and recognizing low blood sugar. But then again, the drugs we use are very expensive in Nigeria. Simple metformin that we use can range from 3,000 to 7,000, insulin can range from 18,000 to 21,000, and other drugs can range from 30,000 up to 80,000 naira. So basic diabetes care coverage can exceed an average monthly income. To improve diabetes care in Nigeria, we must make education continuous, affordable, and culturally relevant.
The International Diabetes Federation reports that a significant percentage of individuals with diabetes experience anxiety, depression, or even diabetes burnout due to the constant burden of self-management. These health experts say a lack of understanding or supportive policies exacerbate these.
Diabetic stress will go on as a lot of psychological feeling of the patients. The worries when you're diagnosed that you're already diabetic. So that feelings, how can I buy this drug? The other one is thinking about his drugs.
For persons with diabetes, managing the disease requires consistent collaboration between the patient and a multidisciplinary healthcare team.
And that's where there is a need for teamwork in the hospital system. If there is a diabetic stress, in some cases, because of the range in the mind, a psychologist, clinical psychologist is supposed to be invited so that he will correct the impression of that particular patient.
What I observe and is all about is a control of what you eat. That is your diet. If you can monitor what you eat, you follow the medical advice given by experts, dietitian, endocrinologists, and the rest of them.
As the world marks today, the message is clear: to create supportive work environment and raise awareness of the challenges people with diabetes face. Tanti Azal, Trust TV, Abuja.